surgical neck dissection, right? So this was the most important things that you have to know about neck dissection. Now coming to the most important topic, or you can say the most asked topic from surgery, that is salivary gland tumor. So you can expect 2 to 3 questions from this topic. So the general question that they ask, first we will try to discuss them, like what is the most common neoplasm overall. So it is pleomorphic adenoma. Yeah. So most common neoplasm or most common salivary gland tumor is pleomorphic adenoma. Now, what is most common malignant neoplasm? So it is mucoepidermoid carcinoma. Most common radiation-induced malignancy, it is mucoepidermoid carcinoma. Now, point to note here is you not only need to know कि I'm telling you most common, because nowadays they are less asking you most common. What they will do is they will give you a clinical scenario where they will say that your patient has presented with a parotid swelling and patient had a history of repeated radiation exposure. So you have to understand that they are giving you hint that this tumor is caused by radiation. So most common radiation induced malignancy is mucoepidermoid carcinoma. It is also the most common malignant neoplasm. Most common benign tumor of salivary gland in children is hemangioma. Most common tumor of minor salivary gland is adenoid cystic carcinoma. So adenoid cystic carcinoma is too important for them and for you, so they are going to ask something from it and we will discuss some more about it. So be with me for some more time. Investigation for diagnosis of parotid tumor is FNAC. So FNAC is the minimally invasive technique by which you can examine the cells of the parotid and come to a provisional diagnosis. So investigation of choice for staging of salivary gland tumor, it will be MRI, because you need to see the depth of invasion and the size and other things for staging. So all the salivary gland tumor and thyroid pathologies are more common in female except Wortham's tumor. So it is more common in males. Now, what are the indication of radiation therapy in a salivary gland tumor? So most commonly the main treatment of choice is surgical excision. But when you are going to give radiation therapy in a salivary gland tumor, so whenever the tumor is of high grade, tumor has a large primary tumor, means that is a very big salivary gland tumor, involvement of cervical lymph node along with that tumor, bone invasion, perineural invasion, positive margin. So in adenoid cystic you will find a feature that is perineural invasion. So in those tumors or adenoid cystic carcinomas you have to give radiation therapy. Positive margin, by that I mean that after the surgical resection of tumor on histopathology you found that the margin, so we take some clear margin of around 1 centimeter to 2 centimeter which should be free of tumor. Now if the margin is positive, you need to give radiation therapy in post-operative phase to make the patient remain tumor free. Now coming to individual salivary gland tumor in a very short and summarized way, the first one, pleomorphic adenoma. Just jot down the important points. Most common benign tumor. Most common site is tail of parotid. So you have to, why I am telling these points is, if the frame question, you have to find these words in your question. So most common site is tail of parotid. Presence of pseudopodia like projection. So enucleation is contraindicated. So initially the surgeons were doing enucleation, but this tumor was again reoccurring. So we got to know that this tumor has pseudopodia like projection. So it is not only removed by doing enucleation, at least you have to take some margin and remove it so that you can reduce the recurrence. Painless in presentation. No lymph node involvement, no facial nerve involvement. Investigation of choice is again FNAC. Management is, or treatment of choice is, superficial parotidectomy, right? Now, many times they increase they ask the names of incision. So incision name is modified hairs or lazy S incision, right? Now coming to second tumor, that is Warthin's tumor. It is also called papillary cyst adenoma lymphomatosum or adenolymphoma. So all these are same. Warthin's tumor, papillary cyst adenoma lymphomatosum or adenolymphoma. So these are exclusively parotid tumor. Most common in male smokers, positive family history. It shows hot spot on technetium pertechnate scan, and again investigation of choice is FNAC, management is superficial parotidectomy. So in all of them, in superficial parotidectomy and all, mainly the facial nerve is not coming in the way, so facial nerve is preserved. In cases when you have to do total parotidectomy, many a time when the nerve is not involved, you have to write there or see for the option which mentions total parotidectomy with facial nerve conservation. So if facial nerve is not involved in malignant tumor,